Hi everybody, this is Deborah Lavinsky with Bella Body Pilates in Phoenix, Arizona. This week is week 7 of our Diastasis Recti review, and this week we're going to cover I'm pregnant, I have Diastasis Recti, now what happens? And I'm going to go through some do's and some things to avoid. So first off, there's nothing to panic about, and you're in a lot of company. Lots of people have had it, and so nothing to worry about. But first off, think about having really good posture. So when you're sitting, standing, you want to make sure that you feel that you're, especially standing, that you have your balance on both feet, that you're not standing with more weight on one hip or another. Also, you want to avoid what we would call lordosis, which is standing and really having a lot of the weight forward. So you have this big arch in your back here, all the weight's forward, and then you have a lot of pressure in your low back. So you want to always feel like you have your ribs down, opening up that mid-back area to make room for the baby. Shoulders down, you want to feel as if your shoulders are over your hips. If you're in this lordotic position, you can see my hip bones are way ahead of my shoulders. So that's one way that you can sort of check in with yourself. Also, when you're sitting, you want to feel your sit bones. So those are the bottom of your hips. Incorporate pelvic tilts. So that is just these little movements we've gone through on other videos where you're just slightly tilting your pelvis back and forth. But you want to be strict about those movements because your ligaments are going to be a lot looser, and you're going to want to feel the urge to really go big on these. So you want to really get the big stretch, but be strict on keeping a controlled range of motion. Really your focus should be on keeping your upper body feeling lengthened. So length is your friend all throughout pregnancy. Neutral pelvis, we've talked about that as well. So when you're doing your activities of daily living, such as like getting in and out of a car, getting in and out of bed, I'm going to demonstrate for you on my reformer. And I give this to my Pilates clients of all ages. A really good way of getting up and down off the reformer. This is how you would get up and down out of bed. So I'm going to walk over to the reformer, sitting down, and then what I do is I pivot my entire body, so I'm not twisting just the top part of my body. I pivot my body, and then I scoot my hips down to the end, and then I lower myself down. So let's pretend I'm in bed and I want to get up. At this point, instead of pulling myself up this way, which if you have Diastasis Recti, forces the pressure right into the spot you don't want to. We don't want to come up in flexion. What we want to do is turn to your side, and then you'll press yourself up to a sitting position, and then sitting on your sit bones with a nice tall posture. If you're sitting in a car and getting out of a car, you don't want to have a forceful twisting. So that's another movement that you want to avoid. I'm going to pretend I'm in a car. I'm going to put my feet down here where the springs would go. Not necessarily a safe thing to do if you're doing Pilates, but for right now, I'm being careful. Pretending I'm driving my car, I'm stopping, I'm opening the door. Same thing. I want to move my trunk, my torso, as one unit. So when I'm getting out of the car, I'm not going to lift my feet up the same way, but I'm going to move my torso together as one unit, rotating my whole body, putting both feet on the ground, and pressing up and out of the car, using my heels, my hamstrings, and my glutes. Just like we've talked about standing up and using that controlled rotation and twisting. You want to use your lateral thoracic breathing. We did that in a previous video. So continue using that. The hug the baby. So that is going to also work on your your core muscles. They're hiding under all of that baby there, but that is going to help you with diastasis recti. You'll continue doing that after delivery. Keep lifting properly. So we don't want to really want to avoid this kind of bending over and putting a lot of pressure. This pressure comes right here through the midline is what we want to avoid. We want to do the squat. We've done these squats before. Please excuse my poor old knees, but you want to get down into this deep squat with a flat back, stretching. This is what you want to do. So you want to take the pressure away from this midline area. Gentle reaching and grabbing. So you want to be careful with your loose joints, again, because you have, with your pregnancy, more laxity with your ligaments. You want to be careful that you don't go too far in your stretches and your reaching. Always keeping both feet on the floor when you're reaching and just with a gentle pull. If you're a person who really likes fitness and exercising, definitely avoid forward flexion. So that would be your traditional crunches, your sit-ups, all of those put excess pressure right here in that midline. So that's where the diastasis recti is. So plenty of time after you have the baby, once the DR is healed, to do that again. So this is just really short term in the scheme of things. You have your whole life ahead of you that you can do those things, but for right now, you don't want it to get worse for sure. And there's other ways that you can certainly exercise just to avoid this pressure. Bending over, I showed you that before. Use the squat, not the rounding of your back. Forceful weighted twisting. Move the entire body as a unit, not just the upper body, and then forcing that pressure again right into that midline. And then sloppy activities of daily living. So you really have to use mind body, be conscious of your movement. I know you're tired, you're carrying a lot of baby around, especially when you're getting into your third trimester. Every effort is very difficult. I carried 2 big babies and I know how it feels. So, but try to be mindful, and once you have delivery, we can start working on some really great ways that we can heal this. So it's not a permanent problem, and you certainly can heal this, be stronger than ever once you have your baby. And you can take these positive steps here while you're pregnant to prevent it from becoming more pronounced. So if you have any questions, you can always give me a call, contact my studio. I'm more than happy to give you a 30-minute consultation and see where you're at. So my name's Deborah Lavinsky. I'm with Bella Body Pilates in Phoenix, Arizona. Have a wonderful day, and thanks for tuning in. Bye.